What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering: do I, as an X-ray tech, still enjoy being 4 years into this beloved field? So I am a night shift X-ray tech. Work a lot of overtime, so I dabble in both days and nights, but primarily 7 on, 7 off. I would say currently, as it stands, I still enjoy my profession. I like it, especially the more you look at other people's career in the hospital that are within the same education level realm, like some of the nurses, some of the respiratory, like other stuff like that. I would say you slowly appreciate your job a little bit more because you see what they do. My lady's a nurse, so I already know, like, I deal with a lot less than she does. Occasionally, we deal with a little bit more, but like on overall job workload and stuff, and like, yeah, we have pretty good, like, even patient care deal. Like, if they order just a chest x-ray, you can be in and out in 30 seconds. And then if the patient asks for anything else, you're just like, the nurse can do it. I'll go get your nurse. So it is a pretty good gig. No complaints, especially nighttime. If you're given the opportunity, I would do it. I work at a trauma 3 ER. It is a very good gig. And like, the longer you do it, you can like pick and you can like see how certain doctors come into your hospital, and you can already pre-plan how the night's gonna be. Versus daytime is a little bit more different, but at nighttime it is quite enjoyable. I mean, it is repetitive, I ain't gonna lie to you. You see the same things over and over, kind of. The only little interesting part about working in the emergency room, you get a little bit of the randomness into it because you get stuff that usually you wouldn't see. I mean, you see constantly MVCs constantly, but like occasionally you see something like crazy that you only see in the movies. So if you want a little spice, I would recommend working in the emergency room. Obviously, working at the hospital, you also deal with the actual people who are in the hospital, like that get admitted. So you do morning portables and stuff like that, which is it's mainly just all chest x-rays, and it does come with a level of you're gonna piss everyone off because it's like we have 2 sides of the hospital. One of the sides we go like at 2 a.m. and wake them up, and then the other side kind of gets like the 4 or 5 a.m. type of run. So we wake them up there. Regardless of what time you piss them off in the middle of the night, they're going to be mad. So you do get a little bit of hate or a little bit of cuss at in the middle of the night for doing our job. Versus like when you're in the emergency room, majority of the patients are awake and alert because they're hurting or they're actively dying and they need your help. So it's a little bit different versus like you shooting people who are. So it comes with both sides. I personally just enjoy being in the emergency room and dealing with whatever comes in. That is, I like it. Now, as far as getting like rewarded, like being appreciated out of all the fields, like we are at the bottom. Like, don't even, like, every single year my lady as a nurse gets so much, she gets all the attention, which at the beginning I was kind of salty, but then slowly each year I just noticed the amount of workload, the amount of notes, the amount of liability, the amount of headaches and stress she deals with. I'm like, you can have that, so I can just be chilling and I gotta work as hard as you do sometimes. Now, obviously with our job you do deal with radiation, so you're just constantly always trying to not hold patients. You're like, it gets a little bit annoying sometimes because like they'll order stuff and you look at the patient and like the patient will be drunk or the patient will be like on drugs and other stuff, and like you can like you look at them and you're like, sir, you don't care. But since I'm professional, I have to care. And like I don't mind holding for people that truly need it or they care, but like sometimes you get people that they don't, they're mad, they cuss at you, they say all that, and I'm just like, why? Occasionally you do get a few patients that you as a technologist, you can refuse to do it based off of just standards and ethics. You can be like, yeah, I'm not doing it. Like there's no reason. And it mainly comes from residents that work at our hospital. They'll order stuff that you'll be like, how are you even able to, like I'll give you a little mini story. There was a patient, one of those like Truman Smith kids, like special need, super contracted, like legs like all hunched up and stuff. And they're like, yeah, we're gonna need bilateral knees, bilateral this, and that. And then we're just like, okay, how you expect us, without breaking this poor kid's legs, get knees and get like, we can get you laterals, cross table, we can do all this other, but like some of them were like, how do you even want us? Like sometimes the doctors will order stuff and don't think what it takes for us to get it. They just order and they're like, yeah, I just want it. I want to see it. They just see the end result. They don't. Sometimes they don't. More of the residents. Sometimes they don't. So it does come with some level of stress and but it's not even stress. It's mainly just like the order stuff that you're like, why are we doing this? Or like sometimes they'll order too much or unnecessary. Like there's certain ways to avoid getting so much. Like it can go from like, we could probably get this in 3 pictures, but you ordered the whole arm for no reason when it's certain, like it's mainly the doctors that cause a lot of unnecessary imaging. And like unless the patient really knows what they're like, most people that are normal people in the world, they're just like, oh, if that's what the doctor wants. And then you're just like, sometimes like you can say no, you know. But overall, I would say I do enjoy my job. I'm very thankful, especially like I always know that there's always, especially in the emergency room, stability. As far as job stability, there's always going to be employment. It doesn't matter what days, years, holidays, tornado, earthquake, whatever's going on in the world. Legally at our hospital, they have to have 2 techs during the day, 2 times like during the night. So like it is a very, very good gig. Yeah, it's been your boy Miguel. See ya on the next one.